All right, today we have another episode from the archives with one of my incredible guests. Enjoy. Welcome to the Trauma Therapist Podcast, a show about the incredible people dedicated to helping those who've experienced trauma. My name is Guy McPherson, and my mission is to raise the awareness of trauma and to inspire each of us to help those around us. All right, guys, welcome back to the Trauma Therapist Podcast. I am very excited to have as my guest today, Dr. Jennifer Sweeton. Jennifer, welcome.
Thank you. Thanks for having me.
You're welcome. So Jennifer Sweeton is a licensed clinical psychologist, best-selling author, and internationally recognized expert on anxiety and trauma and the neuroscience of mental health. Her most recent book is Trauma Treatment Toolbox, 165 brain-changing tips, tools, and handouts to move therapy forward. Jennifer completed her doctoral training at the Stanford University School of Medicine, the Specific Graduate School of Psychology, and the National Center for PTSD. Additionally, she holds a master's degree in affective neuroscience from Stanford University. All right, Jennifer, share with the listeners where you're calling from and where you're from originally, and then let's dive in.
Yeah, so I'm calling in from a suburb of Kansas City on the Kansas side. It's called Olathe, Kansas, and I have a group practice here called Kansas City Mental Health Associates. So we're a trauma-informed group practice. And I'm originally from this area of the country, although I've kind of moved all around in my adult life, DC, Boston, San Francisco Bay Area, Oklahoma, and now about 2 years ago, moved back to this area. So it's kind of nice to be home.
Awesome. Well, again, thanks so much for taking the time to do this. Let's start, as we sometimes do, with a quote, a mantra, something that maybe has inspired you and that can help kind of provide context for what we're about to talk about.
Sure. That was a tough one. I think there's a lot of things that have inspired me and have guided me. I think I was like 2 classes short of a philosophy minor in college. So there's all sorts of things. One that's really stuck out to me, though, it's by Abraham Maslow, and it says, in any given moment, we have 2 options: to step forward into growth or to step back into safety. And I think that one really resonates with me professionally, personally, and just in my clinical practice with clients.
Well, say a little more. When did that become, and I know lightning bolt, it's not like a lightning bolt moment, but I thought of that and I was thinking to myself, a lot of times I'm like, I want to go back into safety, but also want to go forward into, adventure and so forth. But when did that become resonant for you?
That's a great question. So I think, earlier in life, I didn't put it in those words. I wouldn't have framed it like that, but the sense was getting comfortable with discomfort. So getting comfortable not being so comfortable. I think where that came from for me was as a child being a competitive gymnast, and you're always pushing forward and it never feels safe and it never feels comfortable. But that becomes kind of a way of life. And I think that set the stage for me pretty early to learn how to be okay with that, or how to take risks. And use that in order to move forward and to grow.
Cool. And I think, one can certainly extrapolate into how that would be pertinent and relevant when someone in the whole trauma aspect. So let's kind of get down into that.
Yeah.
So when and how did this interest in trauma come about? Tell us that story.
Yeah. Okay. So it's probably somewhat disjointed, but originally, growing up as a kid, I knew I wanted to be a lawyer. That's what I wanted to be. And I knew I was going to go into law. Got to college, and it seemed like engineering was the more reasonable choice for a variety of reasons. It felt like that was going to be the better, stable career for me. So I did that. I went into college, I studied computer engineering, and in the middle of college had a tailbone injury because I was a college cheerleader, had a tailbone injury, broke my tailbone. It's kind of laid up in the dorm room, found my roommate's psychology textbook and thought, geez, this is a lot more interesting than Java programming. So decided to switch my major, sort of an impulsive decision. But that's really what got me into psychology. But I really thought I was going to become a university professor. I ended up going to school, a graduate school for affective neuroscience. So I thought I was just going to be a basic scientist in a university. I think it was there that I really got more interested in clinical psychology and trauma, specifically just through studying the brain, looking at the neuroscience of mental illness. And it prompted me to go ahead and pursue a clinical degree. I actually left after the master's, that program, and went into clinical psychology. And once there, realized that trauma was really what my passion was, what it was going to be. There's something that really resonated with me at a deep level. And, maybe the cliche is that it was my own traumas and my own history that kind of led to that resonance, potentially. I definitely think it's had a big role in my life, but really found that that's where my heart is in treating trauma.
Okay, thanks for sharing that. Let's dive in there a little bit. But before we do, explain what is affective neuroscience.
Affective neuroscience is a study of emotion in the brain. Okay. So what does fear look like in the brain? What does social anxiety look like in the brain? That kind of thing.
Okay. So, you're talking about your background, which, it sounds like you were on a mission. You're supercharged, competitive from the get-go, all these intense specializations. And you mentioned that, you talked a little bit about how trauma, that interest in trauma evolved. And yeah, of course, it's a cliche, but it's, I want to bring in this human element to it. Can you share, you don't have to go into detail certainly, but what were some of those things that might have sparked your interest in trauma, and why?
Yeah. Okay. So, through my childhood, I was lucky enough to be trauma-free. I guess we can think of large T and small T traumas, but for the most part, trauma-free in childhood. First real trauma, big trauma, was at 18, and a couple of weeks after my high school graduation, a good friend of mine died by suicide. That was kind of the entree into it. And had some other experiences shortly after, actually, in college. And what was noteworthy to me at the time, and that always kind of, that I was curious about, I'd say curious once I could heal enough or get enough distance from it to where I could look at it a little bit differently. But what was striking to me is what the feeling of trauma is. So how the experience hits you. And what I mean is really more at a physical level rather than just a mental level. So we think about therapy as being talk therapy or working with thoughts. And even in my graduate program, it emphasized the cognitive work. But what was really striking to me about the experience of trauma is that it's very physical. And I remember it feeling as though it took over my entire body. It's something that's hard to really put into words. And as we hear so often, trauma is unspeakable. And that's exactly the way I experienced it. But really excruciating physical symptoms, but not in the same way as a broken bone. And I think those symptoms themselves, that physical experience of trauma, in a strange way becomes its own trauma, like its own traumatic event, just having those physical sensations or knowing that that's possible. And so when I moved into clinical psychology, I was very motivated to try to help people who I know had experienced trauma, in part because of those physical sensations, which has really guided my approach to treatment, which is cognitive, but with a big emphasis on somatic approaches and memory reconsolidation approaches such as EMDR, but looking at the body memory in addition to the narrative of what happened, if that makes sense.
Yeah, it sounds like you're talking about, on one hand, the trauma of being traumatized. Yes. What was your healing journey like?
Yeah, not linear at all. I think for a long time, it was sort of walking around in a haze, sort of a mix between a haze and then sort of re-experiencing those physical sensations kind of all at once in a very overwhelming way. I didn't really know what was happening. I was really, when it all culminated, probably about 20 years old, about 20. And so I didn't really know what to do with it. I did, about a year later, I went to therapy for the first time. And that was an interesting experience. I thought it was marginally helpful, but not really. I wasn't super enthralled by it, but I also realized that the reason why it probably didn't do a lot for me is that I didn't disclose any trauma. Mm-hmm. So I went to therapy and I talked about normal things, but I never actually went there. It wasn't until...
Just interject here. So did you not disclose trauma because you didn't feel you'd been, quote unquote, traumatized?
I knew at that point that I had been.
Okay.
I very much knew. Yeah, I was fully aware of it. It was avoidance, is the best way I can put it. Just not really ready to go there, but did want to test out this whole therapy thing. I didn't grow up around therapists or any mental health stuff, so I wasn't really sure about it. But I would say I had a positive enough of an experience to where when I was actually ready to go through the process of healing, I did. And I sought a therapist about 7 years later as when I actually started. So I think the healing was in part, in large part therapy, which I'm still in to this day, and a totally, different. We've had different episodes of therapy through my life, but really started the trauma work around 2007 or so. Mm-hmm. And before that, I think there was a fair amount of healing that I did on my own, maybe through close relationships, friends, family, that kind of thing.
Right.
But nothing has been as good as therapy, I've got to say.
Cool. So this is interesting, listening to you talk, Jennifer, about, your background and how you're saying it was predominantly cognitive, but yet you really not only honored, but you felt how trauma impacted and the body. And it almost sounds like you're a convert into somatic practitioner. So let's talk a little bit about, so you talked about the trauma in a sense. How did this book come about?
Yeah. Through working with clients and through a lot of the workshops that I've given, a lot of the trainings that I've done with other clinicians, a theme that I started noticing just in my own work was paying attention to the body, paying attention to physical sensations. Of course, you have The Body Keeps the Score by Bessel van der Kolk and Somatic Experiencing by Peter Levine, all these, great researchers and scientists talking about the importance, and it really resonated with me. And so I wanted to write a book geared toward clinicians, but clients can read the book as well, that lays out as clearly as possible and as simply as possible what's happening in the brain after trauma, and how you can begin to practice tools and techniques that help the brain change in the direction of health, with a real emphasis on some of these bottom-up or body-based methods.
Cool. All right. So I just want to say again that I'm speaking with Dr. Jennifer Sweeton. Her book is Trauma Treatment Toolbox, 165 Brain-Changing Tips, Tools, and Handouts to Move Therapy Forward. Actually, the publisher is kind enough to offer a 25% off discount code, and we'll get to that in a bit for those of you who are interested in jumping on board here. I'll have the links up at the traumatherapistpodcast.com. So, through these workshops and so forth, you saw themes developing. Can we talk a little bit about, kind of dive in here about maybe some examples, what people can, look forward to in the book and so forth?
Yeah. So it's broken down into multiple types of categories of techniques. And a lot of them are a little more, like I said, bottom-up focused. So breathing techniques, body-based techniques, movements and poses, which is kind of an interesting chapter for me to write. And also how you integrate those in with some of the more traditional top-down or cognitive techniques. So there is a chapter on meditations, which I think of as very cognitive, and also cognitive therapy-ish techniques, which is also very top-down. But learning how to integrate those with the more bottom-up techniques as well. So an example might be a meditation where you're checking in with different sensations in the body, where you're working with different sensations in the body and linking those sensations to different emotional experiences and even then thoughts, because there's this idea that what you're thinking about influences emotions, also influences your physical sensations, but also vice versa. Sometimes our thoughts are driven by these physical sensations.
So just to be clear here, this is a book for therapists and clients, or therapists, or both, or therapists to use with their clients?
It's for therapists to use with the clients.
Okay.
So it's written for therapists, but there's handouts and worksheets that are for the clients, if that makes sense.
Okay.
They kind of like corresponding worksheets that they can give to the clients.
Okay. So in your background, or having had the experience of the background that you've had, do you feel that the cognitive approach is more prevalent than the somatic approach, especially when dealing with trauma?
Absolutely.
Yeah.
Absolutely. I just actually had a client start very recently with me, and many, many years of therapy, trauma and anxiety therapy. And she said, yeah, I get the thoughts. I've worked with the thoughts. I've done the ABC sheets. I've restructured the heck out of everything. But I'm telling you, there's something trapped inside of me. And she put it very eloquently. She said, it's in my body. It's trapped in my body and it can't get out. I was like, and of course, that's why she found me, is because she knew that I'm going to come from a little bit of a different perspective. So that was really striking to me. And I hear things like that a lot.
Right. I mean, from where I'm sitting, it's not completely surprising. It's a little surprising because, I'm talking to people like you who are cognizant of the importance of somatic approaches to trauma, but it's nevertheless is surprising to me to hear that there's still, not an acceptance, not an understanding within the educational system, or what?
Yeah, it's been a while since I've been in grad school, so I don't know exactly today what they're teaching, but it was not emphasized at all.
Yeah.
In my graduate work, not at all. And I think with clients, they're not always going to be the ones that necessarily bring it up. This client that I recalled did, but I think there's so much fear of the body and a lack of feeling safe in the body and experiential avoidance that I think our clients sometimes will tend to pull us out of the body and back up here into the mental stuff, right? Where they'll come in and they'll say things like, I just need to stop having this thought about, dying in a car accident. But it's not the thought. It's these overwhelming, terrible physical sensations that go with the thought that are unbearable. It's not usually the thought. But I think just in our work with clients, because of that experiential avoidance, it's like they pull us out of the body back up here. So I think it can be a challenge to get people down into the body, especially after trauma, in a safe, titrated, and manageable way.
What do you think are some of the qualities, Jennifer, that help you do this work, specifically work with clients who've been impacted by trauma?
I have a lot of hope. I think I'm optimistic. I think that's super, super important. Sometimes I'm asked, how do you do this work without easily burning out? And I say it's not like watching the news on TV and being a kind of a passive recipient of bad news. I have a lot of faith in the techniques and the therapies that are out there that I've been trained in, and I think that's a big thing. It's funny because I consider myself to be a pessimist usually in life, but when it comes to trauma, I'm very optimistic about people's ability to change.
Cool. All right. In terms of an early clinical error, mistake, whatever you want to call it, a misstep, share something with us.
Yeah. Okay. I'll share one that's maybe a little bit harder to define and a lot more impactful than just, your typical error. And it's not going to be so early of one. I do think I've done, committed the early errors that most people have, maybe doing exposure work and not properly helping the person titrate into it and their dissociative, things like that. I think about that, in graduate school, having that experience. But I would say in the past couple of years, something that has really changed not only the way I do techniques, but has changed me overall, I think, as a psychologist. I think of one person in particular who had a criticism of me. She said that it kind of felt like I wasn't a person. So she said, you feel like it's like you do these techniques, but I'm not really getting a sense of who you are. And you can kind of come off as a clinical robot. And she didn't tell me this until about 2.5 years into treatment. And she was totally right. And I remember thinking a lot about that. And there's a piece of that kind of, in a way, made me nervous or kind of scared me. This realization that maybe there's a part of myself that has to enter the room a little more than I had been doing. And when I say part of myself entering, I'm not just talking about self-disclosure, but, anytime you're with somebody in a session, there's so many things there that are unsaid, and we kind of can control now how much we're putting our own walls up and how much we're putting them down. Of course, we refer to that as boundaries. And I think I had been trained in a way to really keep things airtight, very, very, very contained, very controlled. And here was this client who was growing and learning and really needed a little bit more fluidity, I think, in the therapeutic alliance. And so I would say that was an ongoing mistake that I was making, where I wasn't calibrating it very well. And so I've had to do a lot of work on myself in the past couple of years to make sure that I am allowing more of myself into the room. And even though that might not look different, or my words that I'm using might not be super different, it's a different feel. And I think it means that I'm a lot more emotionally connected. I think the work has been a lot deeper since then, but I've also become a whole lot more vulnerable in some ways.
Wow. Yeah. I mean, I really appreciate you sharing that, because it does sound like a vulnerable sharing. And that's exactly the word that came up for me as you were talking about that vulnerability.
Yes.
And I happen to love this topic because I myself, I've talked about this before, when I was working at this clinic that I was working at for 5 years here up in Northern California, I was fresh out of graduate school, and one of the psychiatrists who was supervising our training said to us, we were working with kids like between the ages of 12 and 25, and we were assessing and treating early psychosis. And he said, if you're going to do this work, you've got to be willing to take off your clinical hat. Yeah. And I interpreted that as meaning basically forget everything I knew, rob myself of my degree. I just kind of went all the way there. And what he was saying was exactly what you were saying, is you've got to be willing to, well, I won't put those words in your mouth, but how I interpreted that now is you've got to be willing to be a human. You've got to be willing to a certain degree, be yourself and make that's where those connections are formed. And that's where those,
exactly.
Yeah. And that to me is really exciting, but it's not always easy.
No.
Right? Not always easy.
Mm-hmm.
So if you would talk a little bit more about that whole process for you. How did that unfold? What was that like?
Didn't unfold well at first. I think my first reaction is more like pulling away a little bit more. Like, no,
Right.
I don't think
Right.
so. As I worked on it, I found it to be easier with some people than others, of course. I think where I made some gains is really through my own consultation and my own therapy. So, I've had the same therapist since 2007. And gosh, how many times has she said to me, you're intellectualizing. This is what you think. This is not what you feel. This is what you think. And I know you think that. You need to get out of your head, so many times. And she's very psychodynamic. And so she has really helped me, I think, with this. But I think even like 4 or 5 years into working with her, she said that I struck her as mysterious. I'm like, how would I strike you as mysterious? I've been telling you everything for like 4 years, but that there was something about the way I could kind of come off. And so I think through my own therapy, it's really been helpful. Through my own consultation with other psychologists, it's been helpful. And honestly, I can't really say how this is helpful, but I think through meditation, it's been helpful. Even just for brief periods of time before I see someone, just practicing a meditation where I get more in touch with myself. I find that if I'm more connected to myself, I'm bringing myself into the room more. Mm-hmm. And that really has deepened my connection with the people I work with.
Awesome.
So maybe a mix of things.
Yeah, that's awesome. Thanks for clarifying that. So if we kind of jump back to the book here, you talked about Bessel van der Kolk's book and Peter Levine's work and so forth. What do you think your book is adding to the playing field, if you will?
Yeah, I think it's bridging science and practice, between brain science and clinical practice, where you have these neuroscientists, often neuroscience land, doing this research, and the clinicians in the trenches doing the work are never really hearing about it. And when they do, it's very obtuse and it's difficult to understand. So it's bringing this in a way to clinicians in a way that I think is digestible, and also to clients, or at least that's the intent, is to bring it to clients in a way that's digestible so that what's happening in your brain. And, this isn't like a moral failing or that you're going crazy. There's some pretty predictable brain areas that have been changed. And there are techniques that we can use to begin shifting those activations and those connections in the direction of health.
Wow. I love that. I think that's exactly what a lot of people need, actually, because as you're right. I mean, all these great books come out, and especially with regards to neuroscience, and clinicians are like, okay, this is great. How the heck am I going to, bring this alive in the room here? Once again, I'm speaking with Dr. Jennifer Sweeton. The book is Trauma Treatment Toolbox, 165 Brain-Changing Tips, Tools, and Handouts to Move Therapy Forward. We have a promo code for podcast listeners here who would like 25% off, and that promo code is GUY25, so GUY 25. So as we kind of wind down here, getting ready to close out, how about sharing a go-to book recommendation aside from your own work?
Yeah. So for clinicians, I'm thinking clinicians, definitely if you're going to work a lot with trauma, The Body Keeps the Score, definitely get that. A lot of your clients will have already read it. So a lot of times will work with clients who've already been in therapy for years and they're very self-aware and they're up on the latest and the greatest. So I'd say The Body Keeps the Score. From just a therapist perspective also, maybe along the lines of ways that you bring yourself into the therapy room, and that you can, maybe a book that shows that you can be yourself in therapy. Mm-hmm. Check out Irv Yalom. He's from Stanford. Irv Yalom's book, Love's Executioner. And so it's a book where he's going over 10 different patients and what his experiences were with them. And
Awesome.
Very interesting.
And before you go, I'm kind of compelled to ask you an advice you'd have for younger clinicians, newer therapists getting out there who are interested in learning about trauma. Because I'm really intrigued, Jennifer, by your background, coming from a kind of heavily cognitive background, but yet really understanding and appreciating the body's role in this. What would you say to new therapists who are like, I want to start learning about trauma? I don't know where to start.
Yeah. Get training beyond graduate school. For sure. So go to the trainings in EMDR, go to the trainings in cognitive processing therapy and prolonged exposure. Go to all these trainings. Even if you're not going to use all of those techniques, you'll notice that they start to come together and make sense in a new way as you combine information from these different trainings. I'd also say just good old-fashioned practice. You need to get to that 10,000 hour point, right, to become an expert in anything, and to stay in your own therapy and consultation as much as you can, because probably with any work with clients, but I think especially with trauma work, your own stuff, you will always bring your own stuff into the room, even though it's unspoken, and you want to make sure that it's being brought into the room in a way that's helpful and manageable to you. So, and in a way that helps the relationships and helps people heal. So stay with your own work.
What's the best way for people to get in contact with you, Jennifer?
You can go to my website. It's just my name, jennifersweeton.com.
Okay.
And you can reach me through that.
Cool. Again, I'll have that linked up at the show notes page at the traumatherapistpodcast.com. Again, links for Jennifer's book, and you can get 25% off by using the discount code GUY25. We'll have all that at the show notes page. Jennifer, thank you so much for coming on here and sharing your experience and your specialization. I appreciate it.
Thank you so much for having me.
All right. Take care.
Take care.